meeting of the House Human Relations and Aging Committee to order. First thing on the agenda is Representative Kirby, if you'll lead us a moment of prayer, please.
All right. Thank you, Mr. Chairman. Let us pray. Our most gracious Heavenly Father, we thank you for another glorious day. We thank you for the many blessings you bestowed on us. We thank you for all you do for us. We ask that you be with us, guide us, and direct us. Help us to look at everything in your eyes and what will be glorifying to you. In your Son's Jesus' name we pray. Amen.
All right, thank you. All right, today the committee is going to be hearing two Senate bills, Senate Bill 291 and 292, both by Senator Underman of the 45th. What my plans are today is to hear the testimony, and if we get to a point that we will leave it up to the committee to decide whether or not we will take a vote on it today. I'll simply call for a motion at the end of the testimony, and if we have a motion to pass and a second, then we will go with a vote. If not, we will table the matter and come back again. Senator Underman, would you like to come up and talk to us about your bills, please?
Committee, I appreciate having the opportunity, and to begin with, if it's the chairman's permission, I would like to talk about both of the bills together because they both originated from the same place, and then I'll separate them out. But I kind of wanted to give you the background of how these bills came about. And I know the chairman is very familiar because he has been with me in all of these meetings. But these bills originated from a bill last year that created the Alzheimer's and related dementia task force. And since last session, we have literally been all over the state of Georgia and had a tremendous following. Everywhere we go, we have about 75 people who go to our meetings that are interested in the issue of dementia. And these folks are some of the folks here in the room, but they also include families who have been affected by dementia. They include researchers. The Emory Clinic, Wesley Woods Clinic, has just done phenomenal work and are known around the world globally about issues related. Dr. McDonald about issues related to the brain and brain research. So we have met in Atlanta, we met in Macon, and we met in Macon at the same time that the COAGE meeting was meeting, and we had probably 200 people at that particular meeting. So the purpose, and I believe we had 7 meetings, I'm not sure exactly how many meetings, but we were divided up into tasks. The task force was divided up into different groupings of people interested in different issues, whether it was public safety, whether it was policy, different segments, whether it was research. And these bills originated and come from that collaborative agreement that these were the 2 #1 issues that needed to be addressed this session. Now that task force, when it was written last year, lasts for 18 months. So that task force is still in effect. And the purpose of the task force is to develop a statewide plan of dealing with Alzheimer's and dementia. And as a matter of fact, today on the floor of the Senate, I did a Senate resolution urging us to develop that task force, and it passed unanimously. So we have rocked along, and I guess the first bill that I'd like to talk about is the registry. And that is, let me make sure I got the right one. That is Senate Bill 292. And this is a bill that is no different than other registries we already have existing in the state of Georgia. The purpose of the registry is that we don't actually know how many people in the state of Georgia have Alzheimer's and related dementia. And the reason that's so important is because every year in the United States, every day, we have 10,000 people my age, baby boomers, that are 65 years old and older. And within our task force, we have people who actually testified And there are a lot of family members that came that have people who are diagnosed in their early 50s. Used to, when you thought about Alzheimer's, you thought about people in their 80s and 90s. And, you know, when I was a nurse back in the dinosaur days, they used to say, oh, that man's crazy. He's got dementia. He's just gotten old. But now we do have scientific information where it shows the deterioration of the brain, because you can do that with MRIs and CAT scans and know what is causing the symptoms that you're witnessing. And to me, Alzheimer's, I've been in medicine my whole life, is one of the most tragic illnesses, because it's a long period of deterioration. You know, it can last up to 10 years, and it's a very slow process. And I've seen families, I've had personal families, Representative Kirby. I know you know Kate Needham, and she passed away on Valentine's Day. She was the city clerk in the city of Loganville, and I'm doing her eulogy on Thursday. And I watched her in the nursing home and social circle. And I was with her at her house, and then I watched her go to assisted living, and then she had to go to nursing home, and then she had to go to hospice. And that's one of the problems, is the physical cost of this disease process. And, Mr. Chairman, if I'm talking too long, you know I can talk all day about this topic. You cut me off. But the physical cost of it on the state of Georgia is one of the things, other than the compassionate part, is that when people start off with Alzheimer's, it's fine. You may have your house, or, you know, you have some money in the bank. But after 10 years, and the average cost of a nursing home is at the minimum $40,000 a year, and the cost on the state of Georgia, if you become a guardian, if you're relying on the state of Georgia to pay for you, you know, the Medicaid and the dual eligible budget is just absolutely astronomical. So with the aging baby boomers coming along, it's imminent that it's coming. Now, you may not want to take care of these people, but unfortunately, some people the state does end up taking care of, just like when they show up in the emergency room and they're uncompensated care. You have to take care of them, and you are going to take care of them, because they're not going to be on the street, and if their family members don't take care of them. And one of the things that the task force recognized, the main thing we want to do, is switching over to community-based services so that people receive the services in the home, and delaying that cost of going to assisted living or nursing homes, so it's not that huge physical impact. But the registry will give us an idea of where these people are located. We're not interested in who they are. We are interested in their age, because we'd like to know if they have early onset Alzheimer's and dementia. But all their names are redacted. We are interested in where they're located, because if you see pockets and you see trends, we are fortunate, like I said, to have Emory and Georgia Regents and Mercer, where we have one of our meetings. These universities are interested to see if you do have pockets. Maybe you have pockets of where it may be more prominent than another part, and you want to find out why they're coagulated, why they're there in that particular region, and where you need to put an emphasis on your community home-based services. Because like I say, the goal is to keep a person in their home as long as you can, whether you're giving individual nursing care, or helping them do their social services, helping the families. Most people do have families when they start out with Alzheimer's, but by the time they get to the end of the disease process, they maybe have a daughter and a son that takes care of them, because they've whittled down their resources and the people that can help take care of them. They're just exhausted from it. So the registry would be located in the Department of Public Health, and would give us that very valuable information. It also helps us solidify our relationship with the the public sector and the nonprofits, the Alzheimer's Association, and there's other advocacy organizations, COAGE, and other groups, and this would give us the ability to be able to work with these people and know where they are. So the vote passed on the registry, Senate Bill 292. It passed in the Senate 45 to 6. 6 people voted against it. And I think those 6 people were concerned about that redaction of their name and knowing who these people are, and confidentiality. But you have to remember the HIPAA laws, also the federal HIPAA laws intervene there too, so that you don't lose that confidentiality, and I tried to stress that. And the association is here to talk about this particular bill. I believe it's estimated there's about 100,000 people in the state of Georgia. That's what I say, we don't know the exact number. When you're working on the big budget or the little budget, the amended budget, that's one of the things that's so difficult, because you don't know about the services needed and predicting those services. That statewide plan will help us in evaluating in the next 5, 10, and 15 years of how much money it's going to cost us. Is there any questions about that particular bill?
All right. Any questions for the chairman? Representative Rogers, excuse me.
Don't promote or demote me. Senator Unterman, thank you for bringing this. Just a quick question about the registry, maybe a little bit of a clarification.
Yeah, that's what I'm talking about.
This is not something new.
No,
is
it's
that right?
not. We do it with HIV, AIDS. We do it with AIDS. We do it with tuberculosis, which is very important in our county, Representative Kirby, to know where people are located with tuberculosis, because these are communicable diseases when you're talking about tuberculosis and AIDS. But no, this is not a new topic.
And okay, so this is not like you're going into new territory right
No.
there. Registries have already been established. To the best of your knowledge, have there been any problems from the registries or violations of confidentiality?
No, not to my knowledge, no, sir.
Okay, great. Thank you,
I've
ma'am.
been here a long time,
Thank you, ma'am.
and I wouldn't be bringing the bill if I thought there would be.
Representative Jaspers.
Thank you. I'm here,
Yes.
Senator. On line 23 and 24, we're really giving the Department of Public Health, saying they're going to determine what information shall be maintained. So why is that not
Because
very clearly defined?
because it may change. Like I say, we're just now in the beginning. You know, the brain is the last organ in the body that has been researched thoroughly. I mean, if you look at the heart, you look at the lungs, I mean, there's so much research, but the brain is like the last one. And the reason that information in there is to leave it broad, so that you don't have to come back in 5 years and they determine a new test or something that is different, a marker, that you wouldn't have to change it. It's just an evolving field. And if you start putting in specifics about it, like if you put in what was the results of an MRI, well, what about in 10 years an MRI is obsolete and it's called something else?
Yes, ma'am.
You know, you just have to change it. That's my idea. Or blood work, you know, like if they have some genetic testing now, and these advocates can talk much better than I can about DNA markers and genetic markings. If you start putting that in there, the technology changes so quickly.
That could be.
Sure.
Thank you, Mr. Chairman. I guess maybe like some others have thought, you know, at least the minimum of name and all those key things. And I could think it could be an opening for, you know, possible future tests, but there's no time limit on the data, you know, that's going to be kept for 5 years, 10 years. And that's just one of the questions I have. I guess I'm just
Why would you
concerned
stay
why we're not
permanently in a
defining
record?
it even
Well, it's
more.
kind of like your death certificate and your birth certificates; those are permanent. It's to look at trends, and there's I'm not sure if any physicians are here today or the Department of Public Health. Just looking at trends to know that redaction, they could care less who they are. It's just knowing the statistical analysis of where they are and what age they develop it. Like I said, you know, a long time ago, you didn't know that somebody was, we had people testify in this committee that were 52 years old. They can't even come here today and testify because they don't have the wherewithal to testify anymore. And that, you know, I've done a lot of disease processes in my time here, and that's been the hardest thing for me. I can't get somebody like with cancer to come up here and tell you why it's so important, because these people can't talk for themselves anymore. They don't have a brain left to be able to convince someone how bad and tragic it is. I only have family members that can tell you how bad it is. I had a woman who testified, and I don't want to talk too long. She worked for the CDC, and she was 50. She was in her 40s. She was a world-renowned CDC worker, PhD, who did work on water around the world, and she came and testified. And like I said, she's in her 40s, and she can't come down here. She testified last year, but she can't come this year because she can't talk anymore.
Representative Kirby.
Thank you, Mr. Chairman. Senator, thank you for bringing this up, and you know, like, unfortunately, many families, our family's gone through this, and so I
Right.
understand a lot of what you're saying. The only question I have, and then I got another thing. In your meetings that you had, as far as the information to be gathered, pretty much any family you talked to was on board and said anything to help type stuff. There's nobody really objecting to any of this being collected.
No, most people whose families are affected, they'll do anything in the world to try and make it better and want. And because they know, you know, 1 out of how many people are going to have it if you have it in your family? Is it 1 out of 3? Yeah. I mean, your chances, if your mom and daddy's got it, you know, you're not looking at a good scenario. So people that have family members are very much interested in proving. And, you know, we're behind the times. 40 states in the nation have a statewide Alzheimer's plan. 40 states. We're one of the ones left in the whole nation that does not have a plan and has not done legislation like this. And to me, that's pretty sad. And part of that is because we're a young state. We're not like Florida. We don't have a lot of retirees, but my hair's dyed. I'm one of those people. I'm getting there real quick. And, you know, it's time for Georgia to catch up, and it's kind of embarrassing when I go to these NCSL meetings, and we're one of the ones in the nation that does not have a statewide plan, that does not have a data registry, that doesn't know what's coming down the pike.
Thank you. And again, I want to thank you for bringing this up and tell you, because of prior commitments, at 2:30 I got to be out of here, and I'm not leaving because of anything on your bill. So
Don't forget about Miss Needham's funeral.
Any other
It's on
questions from the
Thursday.
committee? Chair has a question. It goes back to something that Representative Jaspers mentioned there about the information and how long it will be available. But isn't it true that most of the people whose information is going to be on there are not going to live past 10 years?
No, they will not.
So the information...
Then they go into a death certificate, so they're on a death certificate. So what's the difference on being in a death certificate and being in this registry?
Okay. All right. Anyone else have any questions for Senator Underman about Senate Bill 292? We're going to hear Senator Underman on 291, and then we're going to have people from the audience come up and testify, and then we will go from there.
Thank you, Mr. Chairman. And 291, like I said before, originated out of this task force. And the purpose of it is to, when we started looking at the Department of Aging within the state, which is in the Department of Human Services, we began to see the fractionalization, the inconsistencies. Aging is a part of a huge budget. The Department of Human Services budget, when you start talking about billions of dollars and you start talking about $4 billion, you talk about the Department of Human Services. It was 36 agencies until we pulled out public health. You see why aging was the redheaded stepchild, and it has been. Public health was the redheaded stepchild. We took it out. Now it has its own autonomy, and it's doing very well. It's flourishing. We have a great commissioner, Brenda Fitzgerald. And now we got to the aging department, and it's the redheaded stepchild, and it doesn't get any attention. Well, why doesn't it get any attention? It doesn't get any attention because it's competing with children. And when you start talking about a child dying versus a senior citizen, a homeless person on the street dying that's elderly, you just can't compete. And the sentimentality is not there. And the emphasis on the department, in my opinion, and this is all editorialized, but like I said, I have been here a long time, and I write their budget. And it was very apparent to these about 75 people on the task force that aging does not get the limelight like they need. And when you go back to that issue of these baby boomers aging out and needing services, you have to put an emphasis, because the voters are going to demand it and the population is going to demand that you provide those services. I know my county, Gwinnett County, we used to didn't pay attention to those children, but when all those parents started moving in and wanting parks and recreation, guess what? We started building parks and recreation for those kids. So this is not much different. This is a lateral move. We're not creating a new department. We have the same agency head. We're just giving them their autonomy and their emphasis to be what they're supposed to be and to be the best that they can be, to be transparent, to be efficient. And the task force agreed with it. And this vote passed in the Senate the same, 45-5. So it's not much different. And Dr. Below is here, and he is the agency head of that, and I'll be glad to answer any questions about.
Once again, Senator, more comment or a reinforcement. This is a lateral move.
Yes,
we are
it is.
not creating a new agency.
No, we're not. This is not growing the bureaucracy. I'm a Republican, and I know all the terminology, and this is not growing the bureaucracy. And if it were, and if I thought it were, I wouldn't be doing it.
And then, would it be fair to say that with the governor and the legislature's renewed looking at DFACs, that if we don't make the lateral move, that there's a possibility that aging could be even, I hate to say less important, but maybe a little bit more neglected?
Yes, that's exactly right. It is the redheaded stepchild, and it's a shame. These advocates that are in this room, unfortunately, have to work twice as hard because people are not empathetic to the elderly.
So, I mean, if we're either going to be, I guess what I'm saying is let's just split it up and let's do it fairly.
That's exactly right, and
that's what you would like to accomplish all the way down the line.
right. And I can tell you, I'm Katie Dempsey's cohort in the Senate, and I have written this budget for 10 years now. And I can tell you, it's an ominous feeling to sit down, and when I get to the bottom of the barrel and I see what money's left over, or I see what money needs to be transferred, aging is one of those left out, because I know on the front page of a paper there's going to be a kid dying, and they're going to get the headlines. And I'm just trying to make it more fair, and that's what this group of those 75 people said, it needs to be fair.
Representative Dempsey's my seatmate. We've had this conversation, so
Okay.
I feel like I'm hearing it in stereo. So, all right, thank you, ma'am.
Thank you, I appreciate it. And it is the stereo. We're like-minded, and we care about people. And you know, if you want to talk about growing the bureaucracy, I'll sit here and argue all day long with you that I believe government should take care of those people that absolutely were the last straw. We don't take care of people we don't have to take care of. We're the last straw, and these aging populations, you know, we take care of the people that we have to, and to me that's what government's function is. And I'll debate that all day long.
Representative Bell.
Thank you, Mr. Chair. Thank you, Madam Senator. So I follow you on Twitter, so I know that you did a lot of great work on this over the summer, so thank you for that work.
Thank you.
Last session, we did this around the Department of Vocational Rehab. Am I right about that? Where
Well, we have done the Department of Labor.
Department of
Several
Labor, I'm sorry.
Several years ago, we dismantled it.
right.
And
But we just did that for rehab, vocational
did.
rehabilitation services. So I was
Yes.
curious to know, I don't know if it's been long enough or even if you have any idea about that.
the best example I have is public health.
Public health,
Because
okay.
public health was a division. Like I said, there was 36 agencies
Right.
in DHS, and public health was one of them. And we were atrocious.
Right.
We were one of the highest infant mortality rates in the nation, one of the highest incidents of tuberculosis, communicable diseases, and obesity. And now that we have a commissioner that focuses on it,
Right.
and it's just been all the difference in the world because somebody cares. Well, we have someone who cares now. We have Dr. Blow, who's a fabulous agency head. He just needs that autonomy
Autonomy to do it.
to blossom, basically.
Okay.
And that is what this is. And it doesn't cost money. It's just putting an emphasis where it needs to be.
Right. Thank you.
Any other questions for the senator? Okay, Senator, if you'll hang around for just a few minutes.
Okay, thank you, and I appreciate it.
Okay. We've got several people that are signed up to speak, but before I call on any of them, I'd like for Dr. Belite to come up to just speak to the committee for just a minute about the task force and the findings of the task force and how it goes along with the two bills that we're looking at today.
Okay. Thank you for having me. I'm Dr. Jay Bulott. I'm the Director of the Division of Aging Services. We've met about 8 times as a full committee, including Representative Benton, Representative Cooper, Senator Unterman, Commissioners Fitzgerald and Reese. Commissioner Horton, the DHS Commissioner, also participated in quite a number of hearings as well. And as Senator Unterman said, we had those across the state. We also solicited input from our website, from our area agencies on aging across the state. And really, the goal of the Georgia Alzheimer's and Related Dementias Task Force was twofold. One of them was to create a state plan on Alzheimer's and related dementias. And what a state plan really does is it sets the framework for how do we as a state move forward in addressing a quickly growing population of individuals with Alzheimer's and dementia. The numbers of Alzheimer's is about 100,000, but we know with some of the estimates that we've done, work with public health in the very recent past, that there's close to 200,000 people living with cognitive disorders in Georgia. That's what we know right now based on our public surveys that were done in partnership with public health and CDC and some other groups. So the state plan that we have drafted and was just approved by all the state plan members focuses on about 5 core areas. One of them is workforce. What are the issues that the workforce is going to have to address and related to a population with dementia? From a training perspective, what is the workforce? If we're talking about healthcare, what do healthcare providers need to know to work with older adults and younger adults with early onset dementia? What type of training, what type of continuing education should be provided? From a healthcare provision standpoint, what are the needs of the healthcare community, those who are providing the direct services to individuals? We know right now, about 5% of the population of older adults with dementia reside in nursing homes. Another 5% with dementia are residing in the community and community-based services. But there's a whole wealth of individuals who are receiving services that aren't dependent upon the state. But what do we need to make available so those individuals can maintain that role in being a primary caregivers? I know we have quite a few members on the committee who are primary caregivers. They don't depend on my services. They don't depend on the nursing home industry to provide those services. What supports need to be available? So the Alzheimer's plan addresses that. It looks at funding. What's the current level of funding for in-home and institutional care across the state of Georgia as it relates to caring for individuals with Alzheimer's and related dementias? What is the current capacity? Right now, we know that our nursing homes are almost at capacity right now, statewide, and that's before the aging of the population, the big aging of the population that everybody's been talking about for the last 20 years, but nobody's really done anything about. So we're at capacity there now. What changes need to happen? Do we have enough dementia specialty facilities to provide that level of care from an institutional side? Do we have that level of services on intermediate care side, assisted livings and personal care homes? And then what needs to happen on the community-based side? Do we have enough? And I'll tell you, as we surveyed the landscape in Georgia, we look pretty good in urban areas. We have a plethora of providers of community-based services, intermediate care facilities, and institutions. But when we get to the rural areas of the state, we have a lot of work to do to make sure we have the resources available. And that's the area that in our survey, the research shows that that's where the population is growing and aging the quickest, in our rural areas. Our young folks are leaving the rural parts of the state. The older adults are staying. When they stay there, we see a much higher percentage of individuals with cognitive disorders just because of the way the population is changing. So the state plan really brings all this together and makes a lot of recommendations. It makes we don't mandate anything in the state plan, but these are guidelines. It's for folks like me and my agency, commissioners and the other agencies, to start revising our policies to be ready for this population. It makes recommendations to regional commissions, the planning that's necessary for cities to be able to address the needs of a population that's aging and aging in place, and to make sure that our businesses are ready to provide these services, our communities are ready to help people stay at home and where they desire to be. So that's the state plan. The other part of the state plan was to look at the most appropriate place to house an Alzheimer's state plan. And we also have a state plan on aging, which is much broader than dementia. And the committee members, and this is the area that I have to be a lot less focused, recommended a separate agency for to house the state plan on aging as well as the Alzheimer's state plan. And I know Senator Unterman worked with Ledge Council to ensure that there was no additional cost associated with that. And as division director, I worked with Ledge Council to make sure that the recommendations being made wouldn't cost anything additional. We don't need any additional funds to be able to accomplish that piece of it. Any questions?
Do any of the committee have questions for Dr. Block? Okay, thank you very much. Appreciate you coming today. All right, we have several people signed up. We're going to ask that you limit your remarks to about 5 minutes, since we're talking on two bills. I think probably we've got some people that are going to be saying pretty much the same thing, but we'd like to hear all of your comments. First up will be Vicki Johnson. If you'll tell us who you are and who you represent.
Thank you, Mr. Chairman and committee members. I'm Vicki Johnson, and I am serving as the legislative chair for the Georgia Council on Aging. And I am here today in support of both SB 291 and SB 292. Our council members, along with hundreds of members of COAGE, which is the Coalition of Advocates for Georgia's Elderly, strongly believe that it is in the best interest of the state of Georgia that aging services be administered separately from children's services. Each year for the past 7 years, we have advocated in favor of transferring the Division of Aging Services to become a separate department. It is our opinion that the needs of Georgia's seniors are very different from those of our state's youngest residents, and that it has been difficult to do justice to both age groups under a single administrative umbrella. Demographics tell part of the story. Older adults comprise the fastest growing segment of the population in Georgia. While the state as a whole grew by 18% in the decade leading up to 2010, the number of adults aged 55 plus grew by 45%. By year 2030, Georgia's older adult population is projected to be the 9th highest increase in the nation. This growth explosion impacts state and local budgets, development patterns, transportation spending, healthcare services, law enforcement, parks and recreation, almost every facet of community life. A new agency could partner equally with other state departments and agencies to collaborate in improving the lives of Georgia's seniors. Using a unique privatized model of management, the Division of Aging Services administers services in a cost-effective way. As an attached agency, it would gain further efficiencies and flexibility to enhance programs and policies impacting seniors. Positioned more independently, the new agency could respond more quickly than is currently possible to expanding opportunities for obtaining resources through federal and private sector grants. The Alzheimer's State Plan Task Force has recognized the value of changing the organizational relationship of the agency that would serve as the designated state unit for administering the Older American Act of 1965 and related programs and services, the Alzheimer's and Related Dementia State Plan, Long-Term Care Ombudsman Services, Adult Protective Services, and other programs and services benefiting seniors. The Georgia Council on Aging concurs with that recommendation, and we ask for your favorable consideration of SB 291. We also support SB 292, another recommendation from the Alzheimer's State Plan Task Force, which would create an Alzheimer's disease registry within the Department of Public Health. We believe that this registry can provide and will assist the state in developing public policy to address the impact of this disease and related disorders. We ask for your favorable consideration of these bills. Thank you.
Anyone on the committee have a question for Ms. Johnson? Okay, thank you. Melanie McNeil. If we get a
Mr. Chairman, members of the committee, I'm Melanie McNeil. I'm the State Long-Term Care Ombudsman, and in that role, I participated in the Georgia Alzheimer's and Related Dementias Task Force meetings. We are advocates for long-term care residents. By creating the registry, we know that very often those folks who are receiving long-term services and supports have dementia or Alzheimer's, either one. So doing more research to make us better prepared to provide services, whether we're a medical provider or even as an ombudsman, would be really helpful for us. So I'm urging you to support and favorably consider both Senate Bill 291 and Senate Bill 292. Part of the reason that we're supportive of Senate Bill 291, I know this question came up in the Senate, the long-term care ombudsman, the state long-term care ombudsman, is actually created in federal law and state law, and we're kind of an independent office at the Division of Aging Services, and we would continue in that role so that we can be advocates. I can come here and speak to you, unlike other state employees who can't do that. Some of the things that would help us by being an attached agency, it would allow the attached agency to respond to things more quickly. Like, for example, for us, we need to attract more retirees to be volunteers to help us in the long-term care ombudsman program. Or as changes to long-term services and supports, you know, as we have more technology, we can do more to help support people. It would make the agency more nimble in being able to address some of those needs. So I ask your favorable consideration for both bills and urge you to vote today.
Anyone on the committee have a question for Ms. McNeil? All right, thank you.
Thank you.
Cindy Nelson.
Hello, I'm Cindy Nelson, and I represent the Georgia Area Agencies on Aging, as well as the Georgia Gerontology Society. And I'm going to ask that you support both of these bills as well, but my focus is actually going to be on creating the attached agency. From a senior's perspective in Georgia, the seniors are suffering. And it's because we haven't had the focus that has been needed, as you've heard earlier today from Senator Unterman. So right now, we have 11,000 seniors that are on a wait list to receive life-sustaining, minimal activities at their home. And so some of these activities are helping them to bathe, or helping them to get dressed, or to get meals on wheels that's delivered to their house, or maybe it's transportation to a doctor's appointment. We call these things home and community-based services. Now, from a state's perspective, we really need for our seniors to stay at home because it's fiscally responsible, but our seniors also want to stay at home. So on the average, we spend $1,884 a year to maintain home and community-based services for seniors in their home. Out of the 11,000 people that we cannot provide services for because we don't have the money, 82% of them, or about 9,000, are currently eligible for a skilled nursing facility level care. So where we're paying $1,884, if those people, the seniors that are on the wait list, can't get this care at home, they can go and check into a skilled nursing facility. If the state has to pay for that, it's a cost of $8,000 per year. So do the math. We're talking 9,000 people, $8,000 a year. And this is because we really have not had the emphasis. The population of seniors continues to grow, but the funding continues to be decreased. In the past year, the areas on aging have had to reduce the Meals on Wheels delivery in most areas to 4 days a week. Now, we know that nutrition is instrumental in keeping people healthy. So without that nutrition, they're going to be going to the emergency room, their health is going to deteriorate, it's going to cost the state more money. We believe that by attaching the agency, that we're going to get more focus and get the kind of support that our seniors need and deserve. So thank you for allowing me to speak today.
Anyone have any questions? All right, thank you. Oh, question. Okay. Well, it doesn't light up. Okay. All right.
The financial figures that you were given, was it by, per year?
Per year.
Okay, so it's 1,800 versus 8,000 per year.
Yes.
Okay.
That's one person. Oh, we have 11,000 people on the wait list. 82% of them, so about 9,000 people, are currently eligible for a skilled nursing level care. Yes, the 8,000 is the state money because the skilled nursing facility averages over $30,000 a year, so federal funding picks up the difference. Thank you.
Any other questions? Thank you.
Thank you.
Kathy Simpson.
Mr. Chairman and committee members, thank you for allowing us to speak. My name is Kathy Simpson. I'm the Director of Advocacy for the Alzheimer's Association Georgia chapter. At the age of 4, I watched my mother go to Central State Hospital, Milledgeville, and see her mother, who lived there, who had Alzheimer's. At that time, she was considered crazy. In 2001, I buried my mother after caring for her for 3 years, having Alzheimer's, and watching her put her head in her hands, shake her head, and say, "Please, God, don't let me be like my mama." Because those two genes run in my family, I have a 50% greater likelihood of having Alzheimer's than someone who does not have a direct family member who has had it. With the growing senior population in Georgia, one of our biggest concerns is that because of a survey that we did with the Public Health Department, the Behavioral Risk Factor Surveillance System in Georgia, we found that 14.3% of Georgians, 1 in 7, over the age of 60, already report that they're experiencing confusion or memory loss that is happening more often or is getting worse, and that 80% of them have not yet seen a physician. The estimated number of Georgians coming out of the census data is that 120,000 individuals in Georgia have the disease. But because of research statistics, we now know that over half of the individuals living with the disease have yet to be diagnosed. Not only is there a silver tsunami, there's an Alzheimer's and dementia tsunami coming. Strong oversight is needed in nursing homes, not just from staff management, but for issues created by family members not taking proper oversight and responsibility for issues such as falls, medications, and behaviors. Staff can't do it all. They need the help and support of families. But we know that there are many individuals who need more focus and attention to keep them from falling through the cracks. My mom stayed at home with me, and I was very fortunate that we were able to keep her at home, but I needed Medicaid when it came time to put her in a nursing home. That was embarrassing to me and to the remainder of my family, but I could not have cared for her with the expensive cost of keeping someone at home. The bottom line is that Georgia's elderly, particularly those who are elderly and at risk, need the full focus and support of a dedicated agency. Right now, the Department of Human Services does Medicaid, they do DFACs, they do children, they do adoptions, they do foster care, they do aging. It's very hard for one agency to split its focus in so many different arenas. The Alzheimer's Association Georgia chapter commends the work of the Division of Aging Services and its director, Dr. J. Bulott, in providing services to Georgia's vulnerable, at-risk adult and elderly population, and we commit to provide any support in any way that we can. Regarding Senate Bill 292, we strongly support the creation of the Alzheimer's Disease Registry within the Department of Public Health. Alzheimer's is the most under-recognized public health crisis of the 21st century. As many as half of the people with Alzheimer's disease and other dementias have not been diagnosed. It's a chronic disease, though often not thought of that way. Most people with Alzheimer's have one or more other chronic conditions. Alzheimer's complicates their treatment. Those conditions complicate the treatment of Alzheimer's. Obtaining a more definitive picture of Alzheimer's is essential to any successful strategy to combat the disease. In 2011, we conducted the first behavioral risk factor surveillance system. The creation of the Alzheimer's Disease Registry will be added to that data to help us be on the forefront of knowing what is actually going on in Georgia. Right now we have census data. We have the first behavioral risk factor surveillance system that we've ever done in Georgia on cognitive impairment, and this year we'll be getting information on caregiver needs. When I cared for my mother, I developed diabetes. They thought I had multiple types of cancer due to the stress that my body was under trying to work full-time and care for her. We need to be able to position Georgia not only in a leadership capacity with other states, but we need to take care of our citizens. We need to focus the same attention on them that we have on others. The registry will allow state agencies to have readily available statistics and interpretation of those statistics to aid in planning to meet the needs of Georgians living with Alzheimer's and related disorders in their families. This will work in tandem with the Alzheimer's National Plan that was passed in 2012. This past year, Congress just voted $122 million for Alzheimer's state national plan implementation, $100 million to research to help get us further along in knowing what causes it and what might detain or slow the progress of the disease, but $22 million across all the states to help care for the caregivers who are taking care of family members with the disease. That's an important step. That's a 22% increase over what's already being funded, that the national government realized there's a need because of what's coming down the pike with Alzheimer's. The data gleaned through the registry will allow Georgia to become more dementia capable, not only strengthening the state infrastructure, but better positioning it to continue collaboration with partners within the medical community, research community, private sector, voluntary health organizations like the Alzheimer's Association, the volunteer community, long-term care industry, and faith-based organizations. Alzheimer's is not a state government problem. Is it a state problem that's looked at and needed to be cared for by all citizens? If you haven't experienced it in your family yet, within the next 5 years you are very likely to. Dr. Fitzgerald's foresight in recognizing the need and immediately moving to address it will allow Georgia to gain clearer, more definitive information, not only regarding those with dementia, but also as to the range and incidence of the diagnosis of dementia. The Alzheimer's Association Georgia chapter stands ready to assist the Department of Public Health in any way, and we urge each of you to vote in favor of both Senate Bill 291 and Senate Bill 292. Thank you.
Does anyone have any questions for Ms. Simpson? Thank you. Sheila Humberstone.
Mr. Chairman, members of the committee, my name is Sheila Humberstone. I'm with Troutman Sanders Strategies, and I appreciate you giving the opportunity to speak before you today. Normally, I would rise on behalf of the Alzheimer's Association, and with your allowance, I'd like to speak a little bit differently today with your flexibility. I also have speak on behalf of a local charity to remember that raises money to support local research. I'm also a member of the Emory University's Alzheimer's Disease Research Center has a task force on younger onset Alzheimer's. So that's the folks that get diagnosed like my mother before age 65. I'm also recently been appointed as a representative for the U.S. Against Alzheimer's group, as well as the Women Against Alzheimer's group, so two national organizations. Dr. Levy from Emory asked me to stand and rise in support of both of these bills for him today. I want to remind you that Alzheimer's is one of the top six leading causes of death. It's also the only one in the top 10 without any meaningful treatment, prevention, or cure. While all other main causes of death over the last 10 years have been reduced dramatically, Alzheimer's is increasing, hence the term silver tsunami that we continue to hear. We are so lucky here in this state to have one of the National Institutes of State's 27 designated Alzheimer's disease research centers. That is housed at Emory, and that is the only one in the Southeast. Dr. Levy wanted to be here today, but because of the snow, he's already jammed with his schedule. Because of the snow, he rescheduled patients on Saturday, Sunday, and today, so he wasn't able to be here. He wanted me to say to you that the creation of a state registry will be an invaluable tool to help the state and ADRC accurately ascertain the incidence of Alzheimer's, a disease that often goes undiagnosed, for planning programs and assisting with valuable research in the state. Creating an agency to house the registry and be responsible for the state plan will be essential to allow effective implementation of both programs. Please know that the Emory Alzheimer's Disease Research Center is here to help the citizens of our state and assist you with questions that you may have about this devastating disease. And I'll answer any questions.
Any questions from Ms. Humberstone?
In terms of the registry, just so y'all know that West Virginia has had a registry for Alzheimer's since 2006, and they modeled theirs on South Carolina, which was already established prior to that. So again, this, to your earlier question, this is not new. A lot of our surrounding states have done it and have been doing it for quite a few years.
Go ahead.
Just as a follow-up to that, same question I asked Senator Underwood. Been, to the best of your knowledge, in South Carolina and West Virginia, no violations of competition?
I haven't heard of anything like that. I mean, really, it's the, as you see in the bill, it says non-identifiable data, so it's really just a numbers. So it's not a person, it's a number, so that we can accurately figure out how many causes the disease. And I think there was an earlier question also about why this was sort of punted to the regulatory process as opposed to being very prescriptive in the language. And I will say that in West Virginia they did a lot of this with regs as well, because it gave increased flexibility. So right now you're allowed to mail or fax it in. I don't know how many more people are going to be using faxes from here on out. I take a picture with my BlackBerry and email it as a PDF. And so I think that's the benefit that Senator Underman was talking about. Giving that flexibility in the regulatory process allows you to keep up with technological changes both in the diagnosis of the disease as well as just how you handle paperwork. If we could get rid of paper, that would be phenomenal.
Any other questions?
Thank you.
All right, thank you. Senator Underman, if you want to come back up. While she's coming back up, as a member of the task force, I sit up here and I look out over the audience and I see a lot of people sitting out there that were at most or all of the meetings that we had, and it was a group that really took serious what they were charged to do, and as a result of that, these two pieces of legislation are the first to come out of the task force. Senator Underwood, we're going to let you take just a minute and summarize both bills.
Yes, sir. I don't think there's much to leave out, except I think there was a question about the nursing home cost. As you know, the dual eligibles in the state of Georgia are the most expensive thing that we take care of in our budget. and that's folks who are usually age blind and disabled, and they're on Medicare and Medicaid. And this is the people that this department that has to be micromanaged to be able to bring down cost. And that's one of the purposes of this attached agency of the Division of Aging, is to manage those costs. And obviously those costs are going to go up because of the population increase. And what gives me heartburn at night is when I look at the percentage of the population that uses the most money. And that's exactly the people we're talking about, because in your later years, the last 6 months to 1 year of your life are the most expensive years of your life because of the cost of health care. And that is not going to change. Health care is going to continue to rise. And this is managing it better and catching Georgia up. I mean, to me, it's kind of ridiculous that we're sitting up here copying a bill from the state of West Virginia that I have always thought was a lesser tier state that was a little bit backwards. I don't know if the news reporters are here, but please don't put that in the newspaper. But, I mean, it's kind of ridiculous that you're copying a bill that comes from West Virginia. And that literally is the plan that we looked at for the registry, because they had a registry. But that to me, when you have a state of almost 10 million people, and here you are, one of the last dogs getting to the dog food bowl, it's pretty bad.
Okay. All right. Any questions for Senator Underman? All right. Thank you, Senator. If you'll hang around for just a minute. Does anyone on the committee have any comments that they would like to make concerning the bills? Opening it up to the committee here. Anyone? Seeing no comments, then I will open it up to the will of the committee and ask for a motion. Number 5. Okay.
Motion. Yes, motion do pass.
I have a motion to do pass. You got here just in time, Representative. We're on 291 right now. 291. We have a motion to pass and a second. Any further discussion on that? Being no more discussion, all those in favor of a do pass for Senate Bill 291, if you would raise your right hand. All those opposed, like sign. All right. House Bill 291. Okay, I counted her as a yes vote. We had 1 no vote. All right. So Senate Bill 291 is a do pass from the committee. Looking at Senate Bill 292, that is the registry. I have a motion to do pass. Have several seconds. Any other comments on the bill? I have a motion for do pass, a second. All those in favor, if you would raise your right hand. All those opposed, like sign. The measure passes. Senator Underman, do you have someone that you would like to carry the legislation? Okay, I'll get with her and we'll decide on that, and I'll let you know on that. All right. Since there's no further business to come before the committee today, we're adjourned.